We're thinking of ourselves at Rush as having a world-class Parkinson's or movement disorder program. And for that, what I would expect to see is a very strong clinical arm, but also a research arm and an educational arm. And we try to work on all these three pillars with the same kind of effort and enthusiasm. People with movement disorders, and I'm in particular thinking about Parkinson's disease, but they have specific needs that others may not have. So if you can tailor to those needs, I think you create a unique environment for patients with movement disorders. It's important to point out that currently there's really no such institution. So towards the end of life in Parkinson's disease, most will have cognitive impairment or dementia. And currently those people are cared for at their homes, by family members, or in nursing homes, where there's no specific knowledge of the disease, and people oftentimes don't get the treatment they deserve and need. And I think when you develop an interest in Silverado for patients with Parkinson's disease and create a specialty care environment, I think it would be tremendously beneficial for our Parkinson patients. Because the needs are different. There's not only the memory impairment or the cognitive impairment that happens later in the disease, but there's also the movement disorder that still exists. So the difficulties with walking and balance and the shaking and the side effects of the medication. So it's a really very specific complex of symptoms and problems that you're dealing with. And if you're not equipped to recognize those and to treat those, then I think you don't do a service to those patients. So I'm happy to hear that there's going to be a development where we can see our patients being taken care for in a nice, understanding and knowledgeable environment. And I think Silverado, because of its focus on memory care, they're extremely well suited to extend that same care for the memory impaired movement disorder patients, the Parkinson patients.